I'll request my friend Dr.Sri Ganesh, who's going to go judge the Rangachari Award, so he has to leave quickly.
Good afternoon, everybody. Thank you, Gaurav, for inviting me to your course. We'll talk on how to manage refractive surprises. Now, of course, after refractive surgery, laser vision correction, now we have been doing almost exclusively SMILE and KLEX from the past 12 years. So I thought I will restrict my talk to the enhancement techniques if you have a residual refractive error after KLEX, lenticular extraction. So what are the techniques for enhancement after KLEX for a residual refractive error? You have surface ablation, you can do thin flap LASIK, you have the circle software, flap creation, and followed by LASIK, or you can also do what is known as subcap lenticular extraction or re-SMILE. So PRK after SMILE is the simplest procedure to perform. It's ideal for low enhancements. You have to take in epithelial thickness if you are considering trans PRK, and it's always better to use mitomycin C, 0.02% for about a minute. You use it for a longer period of time because you have a higher incidence of haze after lamellar surgery. Advantages of PRK is that you are still maintaining a flapless procedure, and biomechanically it's quite stable. This is a paper by Walter Sukendo, who looked at enhancement after myopic small incision lenticular extraction using surface ablation, and he concluded that when you use mitomycin C and surface ablation, then this is a safe and effective treatment for enhancement after SMILE. Coming to LASIK after SMILE can be done with thicker SMILE caps if you have used a cap of 135 microns or more, and again this is suitable for lower enhancements. Epithelial thickness has to be taken into consideration when you're planning the flap and the flap thickness, and femtoflaps of 100 to 120 microns are ideal. There is always a risk of entering the previous interface if you use a thicker flap, and ideally it is not suitable if you have previously used thin caps of 120 or 110, and the hinge has to be away from the SMILE axis incision, otherwise there can be an overlap. So this is a paper by Professor Dan Reinstein, who looked at outcomes of retreatment by thin flap LASIK after SMILE, and he concluded that the results were quite good and predictable, and patients were comfortable. Then you have the Circle software, which is a very special software for enhancement after SMILE. It's available on the Visumax. It allows the surgeon to convert a SMILE cap into a flap, and it has the this is the configuration. It's got 4 incisions. The first one is the lamellar ring, the second is the side cut, and third is the junction cut. So it's got 3 cuts, which is done by the femtosecond. It's not available in the US, it's not FDA approved, but it is available in India. So you have different patterns for the circle treatment, A, B, C, and D. The D pattern is what we commonly use for enhancement. This is a video. You can see that's the lamellar ring and the side cut and the junction cut. And it converts the cap into a flap. So then you can shift the patient to the excimer laser. You can open up the flap, and you enter into the previous interface. So you'll have to know the depth of the previous interface and then set it in the machine. Here it was 120 microns. And then you can lift the flap, and once you lift the flap, then it's like your regular LASIK. You use the excimer laser to do the ablation. Sometimes it can be a little sticky at the side cut or at the lamellar cut, but generally you are able to do that, and that's the ablation. These are a few papers of the circle pattern for creating the flap and doing the treatment. In our practice also, we prefer this technique because normally use a 110 or 120 cap, and this is very useful. And of course, in this series by Chan Sui from Thailand, he concluded that it is quite safe and can be used effectively. And Jodhbir Mehta and his group compared the 4 different types of patterns, and they said that again the D pattern is probably the safest and best for doing the circle software. Then you have smile on smile or re-smile or sub-cap lenticule extraction. Can be done if previous cap thickness is known, can be used for higher refractive error enhancements. Epithelial thickness has to be taken into consideration. The advantages, you can still maintain a flapless procedure. So how do you do it? It is not an approved procedure. After the refractive cut is done, then and the side cut, then you just stop the machine, you put off the suction, and then you just access the original incision. The old interface is the superficial plane. It can be very easily opened up. The deep plane has to be dissected carefully, and the lenticule is extracted. Minimal thickness of the lenticule should be maintained. So usually if the enhancement is very low, if it's like a 0.5 or 0.75, it's not ideal. If for higher enhancements, more than 1 diopter, then you can do this technique. You keep the minimum thickness at 30 so that you don't have too thin a lenticule, and it's easy to dissect and remove. And of course, you have to see the residual stromal bed. Centration is critical, and then you can use a smaller optical zone. This is one of the cases, pre and post-op enhancement with the re-smile. You can see that the flattening has increased. This is the video. So after the lenticule cut and the side cut, you just put off the suction. You go in and access the original incision, and you can see that's the deeper plane which you dissect. Superficial plane, you don't have to dissect. It's like very easy. So this is a deeper plane being dissected, and once you dissect the deeper plane, then you can very easily remove the lenticule. This was a patient whom we had done monovision, and she was not happy with the monovision, a high myope, and then so she wanted a full correction, so only one eye we did that. And these are the first reported case was by David Donate, who did this technique. He called it subcap lenticule extraction, and it's published in the JRS. Jodhbir Mehta and his group looked at tissue responses for different techniques, from PRK to LASIK to subcap lenticule extraction, and of course they have described the various advantages of and disadvantages of each technique of enhancement, and you can go through this if you're interested. So that's about enhancement after smile. Thank you very much for your attention. Thank you.
Thank you for those nice tips. Kumar is going to start his presentation. We are a little behind schedule, but I have done a few cases of smile on smile when there's a suction loss, and typically the company obviously recommends you can't, but you have to really plan it, because you can do 3 things: decrease the lenticule thickness, decrease the cap thickness, and decrease the optical zone a little bit. So you get about 25 to 30 microns, you can do smile on smile. Aborted smile, basically. Wonderful. Very nice presentation. Thanks, Sri Ganesh.